I'm 93 years old, and I'm emphasizing the 93 old for two reasons. Number one, because for the last 50 years, I had daily contacts with seniors. I know how they're thinking, I know how they're going through, and I want to relate some of these experiences to you today and trying to help whatever I can the seniors of your area as well as other areas in the greater Vancouver. The second reason when I'm mentioning that I'm 93 old is because if I make a fool of myself, you know, I'm 93 years old. I'm extremely pleased to be here to talk to you, and I'm extremely pleased to see that you're taking one day of the year to have a symposium between all the extended care facilities that are helped by the government financially, as well as the long-term care facilities. I believe that in your area you're talking about 10. And to get together the people that are looking after the seniors, that are administrating these places, and exchange ideas and observations of how to better relate to the seniors. My presentation to you is of great concern about the seniors. We are in a terrible, terrible situation right now with the COVID-19. We lost about 2/3 of our seniors because of it. A lot of it is in long-term facilities. And I know that the federal government has pledged $3 billion in order to rethink, redesign, and replace the existing facilities with more safer facilities. And I'm quite sure that eventually they'll have smaller facilities with direct communication to the people, to the good fresh air instead of being crowded together. And eventually, from the physical point of view, I think we're going to take control of the situation. My regards, my fear is, what are we doing for the people, for their well-being, for their emotional support? The city of Vancouver has done a study a few years ago, about 4 or 5 years ago. They left it up. Okay.
Emergency line, do you require?
He's fine, please. We'll call you later.
Hi, can you say that again, please?
He's fine, he's in the middle of a meeting. Goodbye.
Oh, okay, no worries. Bye now.
The city of Vancouver has done a study
System ready.
a few years ago, and they spent lots of money. I've seen the 93 pages of that presentation, of that study. I looked at it 4 times to really get a grasp of what they were trying to do and find out. In simple words, I can tell you one thing, that they found out that social isolation, loneliness, marginalization, and abuse of all kinds are killers, bad killers. The answers that they come with in order to help out the situation is providing more benches on the streets, providing more toilets, but really they're not addressing the people that are isolated. They're addressing the people that are still able to go to a neighborhood house, to meet other people, to have a lunch, to have a discussion with, to be in touch with other people. What we're talking about, the isolation of people that have no chance to get all these benefits. And what do we do about it? Let's look at it really fairly in the situation. We have young children. The government spends billions and billions of dollars for the public education. They grow up, they go to secondary education, billions of dollars invested, and they go through life being prepared for a lucrative job or work within the society. They're 20 odd years old, and for the next 40 to 50 years, until the age of retirement of 70 years old, they give of themselves and they help the society. Between 70 to 75 and 95 years old, this is the growing number of seniors. 17% of these people are seniors. Not everybody needs help. 1 or 2% are completely self-supporting. They are wealthy enough, they can get all the help that they need. There's only basically about 16 to 18% of seniors that need their support. They're entitled of it. It's a human right. And the physical support they're getting, it's not enough. They're not machines. They're human beings with needs, with desires, with hurts, with pain. And all these things have to be addressed too in a very proper fashion. You know, the provincial government realized what's happening quite a few years ago in the late 1900s. And they started a program. It was an NDP government, by the way. Started a program of peer counseling. They developed a range of counselors across the province. They supported it financially. And they've done an excellent job. In 2017-16, I don't remember exactly, the Liberal government at the time canceled the program. It was not needed, they said. And we, with the help of the Jewish Federation of Greater Vancouver, took over the challenge to have the peer support program that we're doing today. We're not doing it because we want to do it. We're doing it because it's absolutely necessary to somebody to do it, and to do it in a proper way. And unfortunately, we're doing a job by having, for example, we're working only with senior volunteers. And at this particular moment, we're working with 70 volunteers servicing over 200 families. For the last 3 months, we've been talking to the government. Look, you have a program that is doing well as far as the home support. What you really need, this program needs really, is the emotional support that we can provide. It's not just enough to take a senior, and just call a senior. It's not enough. It can create much more damage than good. We train our seniors, volunteers, for 15 hours if they have to do phone calling, 15 hours if they do have to do visiting, and they used to do visiting and they're starting with the visiting again, and 55 hours of education as if you were a peer counselor. We were there to help the people understand, to help themselves, and to get by themselves out of the rut they were. And we succeeded. We succeeded because there were many, there still are, many organizations that are asking for our help, qualified help. The indigenous community wants our help. LGBTQ community wants our help. Kerrisdale seniors wants our help. Jewish Family Service wants our help. Because we have acquired an expertise, they know about it, they know the success of it, and they call on us to give it. Unfortunately, we have a small budget. We have only 2 people that are working in that. We cannot expend ourselves anymore. And all the trying that we've been done for financial assistance from the government, including the Vancouver Coastal Health, says we're coping right now with the COVID-19. Call us later. Are we seniors not part of that COVID-19 problem? Do we have to wait 3, 4, 5 years or maybe indefinitely in order to realize that we need the help that we need? COVID-19 is not going to go over tomorrow. It's going to be for a long, long, long time. There are still 20 to 25% of the people that are stupid enough not to take the vaccinations, endangering your lives and my lives. And that's happening not only here, it's happening all over the world. Statistics in the United States call for 700,000 dead. That's more dead than all the death that have occurred from the Civil War, including the Civil War, Korean War, Second World War, First World War. Do you realize what kind of a damage that thing is being done? And we say, well, let's wait it for go. It's not going to go. Maybe you think that it's going to be going like nothing. Trump at one time said, it's like a cold, it's going to go away. How stupid. But neither can the seniors wait until that COVID is over. There are people right now that worked all their lives. It's a human right to give them what they need, and that need is not only physical. I know My parents died in one of the facilities at age 96 and 94. Let me give you two stories that are true. In one of these facilities, there was a lady called Sylvia Hill, who was the president of the residents. And she was presented by the long-term care facilities with the discussion of changing the dishes from the porcelain dishes that they were selling or serving before the people into plastic. I came just out of the hospital, I'll tell you. If I were 2,000 years backwards, I would have felt the same way. And she said very clearly, says, look, the meal that I'm taking today may be the last meal of my life. Why cannot I have this meal in finest porcelain, with the finest cutlery, with the finest crystal? We live only once. And once we're dead, forget about it. And how right she was. Let me tell you another true story, because I think it's relevant to what I'm talking about. Our main peer counselor had a client who was visiting in one of these facilities, long-term facilities. Let's call her Mary. She was a refugee to Canada from the South African apartheid. She was a famous painter with international repute. And she was in this facility, and our peer counselor was visiting her. And one day, while she was visiting her, the caretaker came in and said, I'd like to change your diapers. Says, but our counselor asked her, what's your name? Said, my name is Jane. Says, Jane, do you know who you're talking to? Sure. I've been changing her diapers for the last 3 years. But really, do you know who you're talking about? Says, no. Well, let me tell you. Mary is a refugee from South Africa. She was a painter, she is a painter with an international name. I just want to let you know. 2 weeks later, our peer counselor visited the same Mary in the long-term care facility. Mary was wearing a makeup. The room was with the windows open, nice fresh air. The walls were decorated with paintings. The lady was cheerful. All this because the caretaker that was looking after her paid attention to her, did not consider her as anything else but a human being with a life, with a background, with a future. And that's what I'm talking about, emotional support. It's not enough to change the diapers. It's not enough to say mama or papa and taken away from your identity and your existence. To those people, I'm Mr. Serge Haber, and I will remain, and I want to remain Mr. Serge Haber, and that until the last day of my life. That's what I'm talking about. It is very, very crucial to understand what emotional support is all about. How important it is to give this emotional support to everyone in every possible way, in every place. And we have done very little about it. I think I mentioned before that we took over where the government, Liberal government, cancelled the program of peer counseling. We're a small organization. The support of the government is almost nil. And we're begging the government, please let us enlarge, augment the service that we're providing by training seniors, volunteers. We do not have a paid staff that is doing the job. We have only trained volunteers, seniors. And by the way, I've been on the field for many, many years, as I said before. And there's a phenomenal need of seniors to volunteer. You know, there are over 1 million seniors in this province, sitting around doing nothing, complaining about the pains that are non-existing, and what a wonderful thing would be for those people to volunteer. Whatever they give of themselves, they get in return 10 times as much. But perhaps the government can do something about it. Perhaps a small income tax relief and working together with the federal government may bring more volunteers to the field. You know, I remember now for the 25, 30 years that the volunteers are needed. And the non-profit organizations that are working in this province and anywhere in the country are saving billions and billions and billions of dollars and providing a much better type of a service that at any time government would provide. Because these volunteers are not, by being trained of course, are working with their heart and soul. They love the people. They get in love with the type of work they're doing. They understand that tomorrow they may be in the same need, in the same situation. And this is what is very, very crucial to know. We can offer the help. We have the knowledge, we have the expertise. All we need is the money and the willingness of the government to understand what it's all about and to really try to help the seniors in every possible way. I want to relate to you something that is really not new here. You see, my daughter, who's a master's of social work and working in the field with the Ministry of Health of Ontario for the last 35 or 40 years, is here because I was operated 4 or 5 days ago. And when she heard that I'm going to talk about this emotional support, says, "Dad, We're doing this in Ontario for the last 20 years. We have a family health team funded by the Ontario Ministry of Health. And that family, this team comprises family doctors, registered nurses, practitioner nurses, social worker, dietitians, pharmacists, and consulting physicians. Why do we have to reinvent the wheel? Why did we have to work for the last 10, 15 years in the peer support council that we have at the Jewish Seniors Alliance, which is begging for funds to help enlarge that system and perhaps provide that type of support to the whole province? All we have to do is to ask our health minister, Mr. Dix, pick up the bloody phone and talk to the Ontario Health Department. They'll tell you something that has been done for the last 20 years, and you can replicate it and adjust it to the needs of your province any day. I think that I was powerful enough, clear enough, sincere enough to tell you what my pain is. And you know, I want to tell you a secret. There is nothing more that I fear right now than tomorrow. I'm still, thank goodness, physically capable. I just had a hip replacement operation. Hopefully the next 2 weeks, 3 weeks, 4 weeks, I'll be able to physically be well enough, not to run a marathon, but well enough. And thank goodness that mentally I still feel that I'm on my maybe 40, 50 years old. And I fear of what's going to happen to me tomorrow. What happens when all my capabilities are gone? When I have to depend on somebody else to look for me, to change my diapers and call me Mama and Papa, and not ever give me a word of love, a word of support. You know, there are tremendous amount of families that are separated. There are children that are not in place. There are children that are not talking to the parents. They have taken all their money. But there are all thousands and thousands of situations of abuse within the family. It happens all the time. And it's important for those facilities that you're managing to understand very clearly, being an assisted living institution, which is still an institution, or long-term care, that is not just the changing of the diapers situation that has to change. It has to change the understanding of those who care after these people, and to give them that love, that emotional support that so badly is needed. I think that my presentation is coming to close. I assure you, I'm talking out of my heart. We never charge a penny for any of the service that we have ever offered. Everything is free. Everything is available to everybody in the Greater Vancouver. We're here to help you. We're here to help you establish the kind of a peer support service that we have. It's not going to come for nothing because we are taxed right up to the top of our heads right now. But I assure you, it's not into the millions. There's a better home service right now that is doing a fantastic job, but it's costing the government, God knows, 40, 50, 60 million dollars. And you know something, it's a good job. They're doing a good job. But what is missing at that job, and I told them when it started with, is that emotional support. They're giving some of it, but by untrained people that are talked to about it maybe for an hour and a half. Can you imagine what kind of a damage can be created with somebody that is call you after you trained for an hour and a half and says, Joe, how are you feeling today? It says, fine. But that's not all. There's a problem there. I call every week 46 families. I spend at least half an hour with each one of them. You know, in 2 years, I have noticed those phenomenal changes. These are people that have children. These are people that have support. And these are people that are desperate today because they don't know what is going to happen tomorrow. Let me tell you a little secret, and I probably will finish. A few weeks ago, after being isolated for almost 2.5 years, I have a lady friend. We go every day to the park for an hour, do our walking and things. And for the first time, after almost 2.5 years, I had to go to the bank. The bank is on Main and on Fraser and 49th Avenue. You know, I was taken there. All of a sudden I was faced with noises that I haven't heard for 2 years. I saw people running around with children and doing all kinds of things, taking the buses. I haven't seen those things. This is what's happening around. If you come to an institution that has no care and has no support, a kind of support, of emotional support, God forbid, don't be in that situation ever. And that's what I fear at my age. I hope that I was open enough, cruel enough to tell you the truth. And I thank you for listening to me. Thank you.
Thank you so much, Serge. That was really emotional and very stirring. And I don't know if you can see the chat, but there are a lot of really nice things that people have said. They said, thank you for your inspiration. They agree with you. They recognize your hard work. The importance of emotional support is, extremely important. People are a blessing and a wonderful resource, and we need to treat people the way we'd like to be treated ourselves, and to tap into to their wisdom. All right, you're going.
And remember, please, we're here to help you in any type, shape, or form.
Okay, thank you so much. We're going to go ahead and let you go now, and we're just going to carry on. I'm going to quickly put up another poll for the participants, and then we're going to let the vendors into the room, okay? So thank you all. Thank you so much, Serge, for sharing your stories with us and your time. We really appreciate it, and I hope you get better from that hip replacement really soon.
Thank you.